प्राची आप काउंट डाउन
Good
करेगा.
evening, doctors. I'm Dr. Prachi from Shield Healthcare. A warm welcome on behalf of Shield Healthcare. And thank you very much for joining today's webinar on maternal and newborn health way forward. I will hand it over this session to our host, and I'm very privileged to hand it over to Dr. Sadhana Gupta. But before that, a quick introduction to Ma'am. Ma'am was co-chair SAFOG NCT committee, FOGSI representative to SAFOG till 2021, Vice President FOGSI 2016, and ICOG Governing Council member with Best Governing Council Award in 2021. Corresponding national editor and peer reviewer, Journal of Obs and Gynecology India and Journal of SAFOG. Thrice country representative to the WHO on key women health issues. 3 times Korean Award winner for Best Scientific Research Paper. 4 times Best AICOG Research Paper winner. Then Ma'am has authored a book on cesarean delivery, vaginal delivery, a comprehensive textbook on obs and gynecology. Editor of 7 Safe Motherhood Bulletin, ICOG Campus and FOGSI Focus and Book of Safe Motherhood Initiative. Awarded 3 times Dr. D.C. Datta Prize for Best FOGSI Publication and Manual. Then also received an award of Chancellors and Dr. Naval Kishore Gold Medal for Best MBBS and Postgraduate Student.
Okay, it's okay, Prachi.
Right, ma'am. So with this, I will hand it over to Dr. Sadhana Gupta. Ma'am, over to you. Thank you very much.
Thank you, Prachi, and please stop a slide share. So, सभी को गुरु पूर्णिमा की हार्दिक शुभकामनाएं. जो लोग हमारे साथ हैं और हमारे गुरु आज हमारे साथ हैं, और इस शुभ दिन पर हम लोग मदर एंड चाइल्ड हेल्थ के बारे में बात करेंगे. ये हमारे लिए बहुत सौभाग्य की बात है. तो गुरु हमारे बड़े ही नहीं होते, छोटे भी होते हैं. तो जो मेरा प्रोफेशनल बॉडी फॉक्सी में सफर है मैटरनल एंड चाइल्ड हेल्थ का. I have grown up with seeing Dr. Suchitra Pandit, Dr. D.K. Datta, Dr. Sheila Mane as something very, very closely, very, very keenly their way of working and how they put on a small thing in such a organized way. So it is a great, and Preeti who have taken the lead. So she is younger, but what we say that we learn so much from our young people also, from our like younger friends, younger sisters. So it is something great that all Dr. D.K. Datta, Dr. Suchitra Pandit, Dr. Sheila Mane, Dr. Preeti, who have done tremendous work in the field of maternal and child health, are joining today for a dialogue and discourse that what we have achieved so far, how we are going ahead, what are our like lacunae, what are our achievement, and how we can put forward all the mission and making our women, mothers and the newborn healthy in an independent India, which is looking for a 75th year of the independence celebration. So a warm welcome to all audience. And before we go to the dialogue and discourse, I will like to introduce briefly our all people who have done a tremendous input into the field of maternal and child health. Dr. Suchitra Pandit, who is a very known figure in at the national and the international levels. She has been the chairperson AICC RCOG from 2017 to 20, President ISOPAR, President Justice, President FOGSI and ICOG. She has graced the position of President Mumbai Society. Ardent teacher, beloved and followed by her student, and she initiated FOGSI Justice Hypertensive Disorder in Pregnancy Certificate, which has so far conceptualized, and she conceptualized a lot of work has been done on the women empowerment and the youth empowerment when she was FOGSI president in 2014. She has been Secretary FOGSI for the UNICEF Sayan Kishori Adolescent Empower Project at Dharvi for 8 years. And I always have a very vivid memory when a young Dr. Suchitra used to present all things at the Dharvi, what they are doing. Member of Asia Pacific Alliance for Control of Influenza, winner of Lord of Planets Award, FIGO Women's Achiever Award, Maharashtra Medical Council Award. She has been honored Fellowship of Nepal Society, MOX Dr. Desai Award for Excellence. FOGSI Korea on Best Committee Publication. Sahitya, I want the CV of Dr. Sheila Mane. Dr. Sheila. Sahitya Prachi, going on, Dr. Sheila Mane CV.
Yes, ma'am.
Please. So,
Just a second.
anything, what happened? Yes. Yes. And ICOG chairperson and FOGSI vice president, he is yet to join. And Dr. Sheila Mane, it is a real pleasure to introduce Dr. Sheila Mane and to have her in today's dialogue and discourse. So Dr. Sheila Mane, Sahiti, please, can I have her CV? So Dr. Sheila Mane is known all over very, very fondly as a PH lady. And she has done ardent work, like a very, very innovative work as the chairperson, Safe Motherhood Committee with the Best FOGSI Best Committee Award. And then she has been the FOGSI Vice President and done nationwide PPH workshop. So Sahitya, either you stop slide share so that we can start this thing. From Dr. Sheila Mane in the future maternal and child health. So a warm welcome to all the audience. Warm welcome to everyone. And we come the first question to Dr. Suchitra Pandit, who has graced the various presidential positions. Yet we have seen her growing when she was doing very small work. So Dr. Suchitra Pandit, you have been the joint secretary to Dr. Dr. Usha Saraya. And then you have been working very closely with Dr. Durusha, and you have that Dharavi, when the Dharavi was not, like, they were real, very, very poor and in the slums. So how did you get this idea to work for the most marginalized people? And when you worked for the Kishori project and the doing like a Ankur project or something like for anemia, how did you you gain that experience in that younger age that drawn you to the work at the wider platform?
Yeah, thank you first of all for having me for this particular session. See, I was always very, very keen on working for the adult and the subject to adolescents. So I thought, once I am at Sion Hospital. Sion Hospital was the place where I was initially associate professor and then later on became professor and unit chief. I said, why not we work at our own areas? Because Dharavi Urban Health Center is just 5 minutes drive from the main hospital. And then we have this huge Dharavi slums. We have got so many girls who are, school dropouts. So we had got that information from the preventive and social medicine department कि इन लोगों के लिए तो कुछ ना कुछ तो करना चाहिए. Luckily, at that time, we had a fantastic dean, Dr. Armida Fernandez, who we call her the Mother Teresa of Science. So I had talked to her saying, yeah, Suchitra, let's do something about it. And, sometimes it's like a coincidence, like-minded people think. And Durusha was also very keen on youth and, adolescence issues. So we just happened to once be, because I was already joint secretary to Dr. Saraya. So I knew the FOGSI sort of hierarchy. And then I was chairperson of Young Talent Promotion Committee. So I just told Dr. Durusha, this is something which I'm very keen on, saying, something I want to also do some work. So that's how 4 people got together. And I was the junior most in that group. And she said, okay, can you organize a meeting? And I organized a meeting and, all the 3 big people came together. We had the preventive and social medicine department involvement. And then she said, okay, I said, look, we will do everything, but we don't have the funds. So the funding came from FOGSI through UNICEF, through Intergold Gems, and we started writing the project because I had some experience in writing projects. And when Daksha Pandit, who was, he stepped in as a new head of the department, she and me, we wrote out the project. Initially, I wrote it out about 5-6 times. And every time UNICEF would say, no, ye nahi karna hai, wo nahi karna hai, do this, do that. Finally, we got the final format and we started doing this work. And I thought it was a humongous task because you have to train the Anganwadi workers for the reproductive child, health and about the education. And there is a UNICEF module. They had given us the data, but we have to create the manpower. So there were some people from FOGSI said, we don't mind coming in. But Dharavi being the slums area, it was not easy for everybody to access. But from SIAN, I created my own residence and I said, okay, let's go and let's start, talking about this. Taksha Pandit would set PSM resident. And aisa karke, we took 3 months to train all the Anganwadi workers. Meanwhile, we got the baseline demography of the entire area. And we had 1,600 girls in the age group of 13 to 16 who had actually dropped out from school for financial reasons, for whatever reasons. Sometimes certain communities don't allow the girls to get educated. And mind you, nobody will understand this, but in Dharavi, there is one small little room where there are 10 and 12 people staying. And how these girls used to manage, it was really an eye-opener. And then once these Anganwadi workers were trained, they started training the girls. Then we established the adolescent center at the UHC Dharavi. Lots of permissions with BMC, but fortunately, because our Dr. Armida Fernandez was there, she would say, no, you just go ahead to the BMC, take permission. I'm there. I will call up. And so aisa karte karte, we got all the permissions in place and the project went on. We did a full baseline survey. We trained the Anganwadi workers. We trained the students. And those girls, they would come to the adolescent center. We taught them newspaper kaisa padna hai, because some of them were educated. Hindi mein, mostly Hindi. Some of them could also read a little bit of English. We started, they had some small little courses going on here and there. We got everything together. So they could do sewing, cutting, beautician's course. Then through Durusha, we got some donations of computers. Old computers, companies ke rehte hain. You got a computer teacher. So the girls started learning that. Then we had a fantastic coordinator. We had to change 3 before we got the right person. She had planned, she would take all the girls batch by batch to the post office. How do you actually access the post? What do you do? In those days, we had more of post office and we didn't have emails and all that. The emails had just started to come. Then we got them to, go to the bank. How do you write a check? So aisa karte karte, it was a fantastic experience. And then the UNICEF suggested, why don't you do a peer group leaders training program? So from those 1,600 girls, we chose about 45 girls and we made them the peer group leaders. So they would do the work that we are doing. So they would actually do. So this project for 8 full years, I was a secretary. Every year when they passed out, we gave them, we had a certificate distribution program. So every 6 months they would pass them. We had, say, about 80, 85 girls who had done the courses. We would call a celebrity, like we called Vaida Rehman, we called, Sonu Nigam, like people, whoever were available and who would not charge us, they would actually come and they would give the certificates. And the girls were thrilled, because this is an achievement. But then the moment I left SIAN, the whole system changed at SIAN, the head of the departments changed, the deans changed, I changed. And apparently I heard that they shifted the program out of SIAN and Dharavi. They shifted to it completely differently. It was still going on for about 5 years after I left, but now the project is not there. But at least we are happy that we could train all these girls. And one small example I want to give you. Dharavi Mena, the Muslim girls and the girls who are coming from Bangladesh, they're getting married at the age of 13 and 14. So we had this wonderful peer group leader called Hasina, and Hasina had 10 girls with her. The moment she got to know that this particular girl is getting engaged to get married, they went like a big lock, stock and barrel. They went to that particular house. They took the parents along and they said, "Nahi, iski shaadi abhi karni nahi hai, 18 saal tak karni nahi hai." So what all will you ask a boy? Aapko HIV ho, you can't ask that. But you can request them, आप प्लीज HIV का टेस्ट कर सकते हो, आप सिगरेट पीते हो, आप बीड़ी पीते हो, आप दारू लेते हो, आप गुटखा खाते हो, अगर ये सब में नहीं आया तो ही वो लड़के से शादी करना. So this Hasina she was amazing. And she finally got married at the age of 24. She was a smart girl and we encouraged her to, complete her graduation. She had started working on that. So finally, I don't know whether she gave the final exam, but at least padhai to karti thi. So, these kind of projects should go on in other places. A lot of people in India asked us, hum aisa karenge? I said, please do it. But, it takes a lot of time, patience, energy. And if you go through Dharavi na, aapko kapde pure, pair aisa upar, you have to take the sleeves up and you have to walk on your toes because there's so much of stuff flying all around. lots of gullies, nalas. To even climb up to go to that adolescent center was okay, but to climb up and to go to the training room, it was so difficult because it was a steep vertical climb, almost like climbing a ladder. But at that time, we had the energy. I had the energy, the enthusiasm, and we projected this project at so many places, and everybody, even internationally, FIGO also, they said, wonderful work. If this is going to be the way things are carried forward, I think you should start doing it at a larger scale. But kya hota hai na, Sadhana, we are clinicians. So at one particular time, you have to say there should be other people also who should, do this. But as an offshoot of this project, I did about 7 adolescents, small little projects, and at different centers all around. And my residents would actually do them. I gave it to them like a thesis, a practical, clinical, plus studies. And all of them, you won't believe, all those 7 projects have got prizes. And I was very happy that people actually realize copy karke projects banana, no, do something which is going to be useful to the community. And that's how I feel that was one of the best projects that I did in my life, followed of course by the Ankur is of course still going on. They don't call it Ankur, but they call it Planned Parenthood. And I must give the credit to Satara Society, because they were doing some things. We just made a little more formalized structure, and a lot of those places in those areas are carrying on this particular project.
Thank you, Suchita. It was something great story, because many like people, since like it is around 20 years ago, many people must not be knowing, and what actually changes you, the beyond the looking the world in the different perspective. And it actually, what you said, that you involve resident, postgraduate. So hope that all experience would have a very everlasting effect, and they must be doing very good wherever they must be practicing. So it is something very inspiring, and I have observed you from since that time, and I was very keenly used to listen how you presented report and how you, all these things what you are saying. But it is something very very interesting and inspiring to all the people, especially the young generation who is with us. And sometimes really they are getting totally, like what we can say, they are not knowing actually what a doctor's life can put forward. So going for this thing, power and the positions and the money, but they comes automatically to you. But it is something which was very great. So coming to, after that we will come to you, Dr. Sheila Mani, whom actually I took the baton as a chairperson, and I always say Dr. Sheila Mani took many so small things so meticulously. And few things what I remember, that presenting the PPH box right in the managing committee, that this thing they are having. And yes, Dr. Sheila Mani, now you can stop this. Dr. Sheila Mani, she has been introduced, and yes. So, and taking up all the suggestion that what can be added by, like it should have the gauze for the packing, when that time the vacuum concept was not there. And as a FOGSI vice president, took the actual pattern involving everyone on the all workstation, and how enthusiastic she was like doing PPH. And I think not in the chairperson, as a vice president, you are known as a PPH lady. So Dr. Sheila Mani, you were in a metropolitan city, you were from the big society, but as a chairperson, you could like consider all the small things what a clinician in a very small place faces when they face any obstetrical emergencies, or the like a postpartum hemorrhage. So what was your thought process, and how could you like go on working in such a wide scale, from a very small thing to a pan-India and international level?
Thank you, Dr. Sadhana, for inviting me. I must tell you that being an active person in Bangalore Society of Obstetrics and Gynecology helped me. And I must tell you that there is so much of cooperation amongst us. Dr. Lata Venkatram, who was the president of Bangalore Society, after me she became, and collectively, we started this emergency obstetric care module. And it was prepared by very senior people. I think Dr. Malti Rao, I must acknowledge, who is not there. Few are still there, Dr. Jaya Narendra, and all the seniors, they sat together for months and months together to think about it and to come out with that EMOC box and all those things. So it was first created in Bangalore Society of Obstetrics and Gynecology. And that time AstraZeneca supported us actually to make those boxes and fill up the things, because Carbocrost was, we were using it extensively for PPH. Okay. So like that. And first we propagated it in Karnataka itself. Like we collaborated with government of Karnataka, and I thought that, as you said, that the ground level health worker needed that. So we started doing these workshops with government of Karnataka for the doctors from PSCs and from CSCs along with nurses. So we had 4 things, that is a PPH, eclampsia, and then we also took sepsis and aseptic precautions. And we used to have a didactic lectures, and literally there used to be a drill, as well as there used to
Hello. We lost connection, Sujita. Dr. Sheila Mane. Hello. Am I audible?
Yeah,
Yes, Sadhana,
it's-
audible.
yes, it's frozen.
Dr. Sheila Mane, Shraddha, Dr. Sheila. So coming to Preeti, I think Dr. Sheila Mane, we will just.
Yeah, I think you ask Preeti till Sheila comes back.
To you, you have that like perseverance to do a lot of things, because I always remember our first contact when you were calling me for the Lucknow conferences, and without any like a thing for any recognition or for name, you were persistently doing the work for so many programs and so many things. So we could always recognize Preeti as a something core of all organizational events. When you took the charge as a Safe Motherhood Committee, and suddenly the COVID came back, and I think you are the one of the few first person who took this opportunities into this challenge into opportunities. You were the first few one who could think of using this virtual platform for teaching paramedicals, and that too very, very emergent issue of the healthcare training on the how to like do the all protocols for the COVID time, and how to do triaging, how to do the things. So Preeti, how could you like foresee the thing that this virtual platform can be like utilized in such a wider platform, and you could think of reaching to the paramedicals pan India, and with all the training modules and involving faculties? So just your experience, so that everybody like get some tips from you that how to organize the things on a in a very difficult and the challenging circumstances.
Thank you, Sadhana ji. Can you hear my voice? Actually, there's a net connection issue here. So I've
Yes,
joined
loud
from
and
home.
loud and
Thank you
clear.
so much, Dr. Sadhana, for inviting me here on this very prestigious platform and sharing dice with Dr. Suchitra Pandit. I think they are legends in their field, Dr. Sheila Mane and Dr. Datta. You know, when I took over as, because I was organizing chairperson, secretary of one of the national conferences, ICOG at Lucknow, and I was very preoccupied with the conference work. And maybe next 6 months also, again, it was a lot of work. But then when I took over as a committee chair in Lucknow, I was given a responsibility of society liaison officer for a FIGO project. So this was under Dr. Alpesh Gandhi's tenure, and he made me society liaison officer. And my job was to connect FIGO, FOGSI and UP government together. And this was a project which was supposed to be conducted in 10 public facilities with 2 nodal centers, KGMU and BHU. So I was totally unaware what actually this project and how this will move in COVID time. But then, you know, the FIGO came forward, and then MGH Howard came forward, and they started trainings online. So we were supposed to be master trainers for that session. The entire KGMU team, the UP Technical Support Unit, government here, and then BHU team, we all were, you know, trained as a master trainer in PPH. This project was on PPH. And it was a huge responsibility on my shoulder, because I was supposed to manage everything. because this was a funded project and this was a new experience. I had absolutely no idea how the projects move. But gradually when I got into it and I thought, I saw that, they had a very beautiful modules like Thinkific modules. We were trained on that. And then we started online trainings for the public health facilities. Then when I was doing this, it came as a bundle approach for PPH. So it was not because Dr. Sheila Mane had already done a lot of work on PPH. But this bundle approach, when we started working in public facilities, I came to know that it really works because it was stepwise management, and the healthcare workers were the staff, nursing staff in these CHCs, district hospitals. They were, adopting it very nicely in their facilities, and the system was improved, the infrastructure was improved, the referral linkages was improved. So this project actually linked the periphery into the central system, like the referral was strengthened. So what I'm working in a private sector, I always feel that the private sector is always neglected and it is unregulated. And the Manita is the only program which is running in the private sector. So it immediately clicked in my mind, why not I start the same project in the private facilities and link those facilities to the tertiary center where they can refer their patient very easily. So the WhatsApp groups were created where the patients were referred very properly and managed, and there was a proper feedback on these patients. So then I started the same module, almost same structural module. And I took the permission, but again, Dr. Sadhana, as Dr. Suchitra said, funds are always a problem. Then I took over Jeevan Dhara, the same project in the private sectors of UP, Bihar, and Jharkhand. So why I took these facilities, these states, because the mortality and morbidity were little higher in these states. So I took those facilities, randomly selected, some were Manyata, and some of the remote areas like in Bahraich, very remote areas near Nepal border and all. So we try to connect because most of the patients are referred to KGMU. Similarly, we took Prayagraj, most of the centers, the patients are referred to Prayagraj. So that is why we started linking those centers, and this was a huge success. Virtual trainings, made a huge difference, and then we did cross mentoring. It was not funded, but believe me, every organization came forward to help us. So when you have a mission and a motive, people come forward to help you. And I think FOGSI is it's a beautiful platform, a huge platform where you can deliver a lot of things. So Japaigo came forward, UNICEF came forward to help us in different ways, like providing technical support, then providing IC material. Then NHSRC also came forward, there's big support for us coming from the government. Then Pathfinder International, they donated 200 NASGs. And then ESM UBTs were donated by Howard, MGH, Dr. Thomas Buck. And then it became a collaborative, and then we, trained almost 100 doctors and 400 healthcare workers. Similarly, at that point of time, USAID also approached us. Looking at this work, they approached us in Jharkhand. They wanted to do another project on Bistrit, that was on anemia and GDM. Now, by that time, we had an idea, this is an addiction. When you start doing things and you see the results, and you see the data that it is improving, you are saving lives, then it becomes an addiction. And I think nobody better than you knows this well, because you have been a ground worker and you have been working for years. I have been part of your training programs for PPH also. So it really, I think FOGSI and organization should divert its attention towards such kind of projects. So there are huge funders here. You can trap those funders, and you can really work in the private sector, because the public facilities are already taken care of by government. Every time I go to the government, UP government, and talk to them that I want to train private sector, every time the question is raised, why the pregnant woman is going to the private sector? Why not to the public sector? So that's the question. Different in different states. The mortality is different in different states. The issues are different in different states. So right now we have stopped focusing our attention from Jharkhand, because the MMR is very low there. They have achieved their target of 70. But then Bistrit also was an eye-opener for us. It was a funded project from USAID. And they did a focus group discussion where they called healthcare workers and doctors, and we were, kept behind the screen that you will not speak anything. Let us have an interrogation with them, how this project move. And that was also a learning experience for us. And then these projects, created demand. So then Dr. Jayam madam said, Preeti, you should do this in Trichy also, because in Tamil Nadu, somehow the maternal mortality is increasing. So that is why we went to Trichy, we did Thainalam. And then a lot of Nepal then requested us to do the program there in Nepal, and then Sri Lanka. So it was a demand generating. So the quality of work that you do, and when you produce the data, and you will not believe, as a Safe Motherhood Committee chairperson, I received n number of appreciation letters from Jean Conray, the FIGO president. I received the appreciation from the USAID, Sangeeta Patel, the head of the organization. Then the Japaigo team also, the head Dr. Somesh Kumar also extended the letter of appreciation. The kind of work, the result, the deliverables that you are giving. I think FOGSI, through FOGSI, you can do n number of things for the maternal and newborn health.
Thank you,
Just
Preeti, for something
one
great.
more, I just want to just say a few words that in UP, like where the maternal mortality is so high, like 170 or 160, we have taken 2 districts, Sitapur, and Fatehpur, very remote areas. I think there are no FOGSI societies there. Even the FOGSI members are not there, but we are taking it ahead as a total district approach. The government is training the public facilities, and we have taken the responsibility of training the private facilities. So it's my urge through this platform, or Dr. Sadhana, if you take this forward, then my urge would be that you need to target these areas where really the work by FOGSI is needed, where the maternal neonatal mortality is still higher, and where we need to concentrate. So thank you so much. I think I have taken a lot of time, but still a lot can be spoken on this thing. But then definitely with time and with the work, you learn so many things.
But Preeti, actually, you could really cross the boundaries. And Dr. Sheila has joined us with a little internet. Actually, she was sharing. So,
Sadhana, before that, can I just give one comment?
Yes.
I'm not just praising Preeti because she's in front of me, but the enthusiasm which she has shown. There are many people who are her contemporaries, and there are people who, everyone has a reason for doing whatever. But if you feel from your heart, you start doing things. And as Preeti very rightly said, once you start getting the result, it's like a passion, and then you go more and more into it. So keep up that passion, Preeti. Forget about, anything, there are politics, there are jealousies, whatever. Just keep up the good work. That pure, genuine, urge to do work should be kept lighted.
And actually, the thing what Preeti could do, actually, that is the networking with everyone. And there was, because she could have the data, and she have the very good organized team, that creating a team, that is something very wonderful. And that convinced so many stakeholder, non-governmental organization to come forward. And we actually look forward to carry on these all networking issues, so that we can really do on the mass level, and what all regional specific variation. What Preeti said very, very correctly, that we have to identify, yes, overall we are having around 100 mortality per 100,000, but actually there are a lot of state variation, lot of regional variation, and we have to look deep into it. So thank you, Preeti. We will again come to you. So Dr. Sheila Mane is back a little bit virtual connectivity. So I think, Dr. Sheila, you started from where you left. You were telling about the all PPH box and the Bengaluru people contribution. So please, because everybody wish to listen those stories. No, आपकी voice नहीं आ रही. Your voice is
Sheila, unmute.
Unmuted. You have to put you have to check the settings.
Unmute yourself.
Unmuted है डॉक्टर शीला. मोबाइल से आप कीजिएगा, मोबाइल से ज्वाइन कीजिए.
से ज्वाइन कर रही हो, इसलिए मैंने
हाँ, ये वॉइस, this is now it is audible from mobile. It is audible.
So
Sheila, just switch that off. Switch the PC off.
PC को off कर
Is it okay now?
Yeah.
हाँ, yes.
Yeah. So I attended MOX and Dr. Nazar Sharia had invited me, and it happened so that Dorothy Shaw, Gamal Sarur, and Dr. Andre Lalonde were there in that workshop. And they just asked, do you have a PPH box? And then luckily I was carrying everything that day. And then Nazar told me to show it to them, and they were really very happy to see that such a simple thing, you know, is been made, which is so useful for the smaller hospitals as well as the peripheral hospitals. So then, and that is how I think my FIGO journey started, I can tell you. And Dr. Gamal Sarur and Dr. Andre Lalonde, they invited me for the FIGO in Rome. And then I went to Vancouver as well as in Rio. So anyway, that was international, but you know, the huge crowd and, you know, the people, I mean, even abroad also what we find, you know, like people from Africa, people from Egypt, all these countries, they were so eager to learn. They were so eager to learn. So I had different stations in all these conferences. So it was a very good experience again. In fact, one of the lady from Latin America came and hugged me, and she told me that she has watched my video. So what I felt nice is that, as Preeti said, you know, you go on doing it and then it becomes your passion. And I think the God only shows you the way. It is said in Upanishad, you know, that once you start doing something, the doors automatically opens. So that way we started with those EMOC workshops, and those PPH charts and eclampsia charts also are very popular. And I believe when Dr. Niranjan Chauhan had attended, I had distributed, and it's there in most of the corporation hospitals in Mumbai also. Because my first workshop was done with corporation only in Mumbai in Sayan Hospital. So I mean, when I come to know the results that people are using it, I feel very nice, and indirectly it must be really helping them. And then we did an international emergency obstetric conference in Bangalore with Dr. P.C. Mahapatra and Melisha. That time also we distributed these boxes in Varanasi, in All India Conference, in high-risk pregnancy workshop. Again, I carried because we had so many here, you know, and I really carried it, parceled it there and distributed it. So that is just to spread the message. And now it is there on the FOGSI website also, where like I think the current FIGO president acknowledged that there is still a need for PPH particularly. And I had an opportunity to invite Professor B. Lynch. Okay, I met him in Cape Town. I forgot. Cape Town, I met him. And Dr. Bellad introduced me, and Dr. Mantesh from UK. And my first PPH workshop I did was with B. Lynch in Bangalore, and which was such a huge success. And I think I really learned so many things in those workshops also. And from there, I thought that I should take up this initiative, because the first time we learned about blood loss assessment, which was so beautifully shown, like we prepared the blood out of jam and prepared all the stations, and then we started training people in Bangalore, in medical colleges particularly, even the group D, because it is very important to train each and everybody, particularly for blood loss assessment. Also, I think I must have lost the count of how many programs we did. And then COVID gave an opportunity to spread it across India, you know. And I really don't have the count, but it really helped again during COVID time. Even though we were sitting at home, we could reach out to so many people, and it was so nice. And I would like to thank Dr. Suchitra Pandit, because when I was the vice president with her, she gave me a free hand to do these PPH workshops. And I think I must have done around 30 workshops in a period of, like, from, you can say, from Kanyakumari to Jammu and Kashmir. So I went to Kashmir also. So there also we did it. So from there, the PPH journey, you know, as even though I was not in a position, it just continued, because I knew that, and all of us, we know that it is needed. And I think all of you were involved with me. Dr. Suchitra Pandit did a South Zone Yuva FOGSI in Mysore. Again, we had an opportunity to invite Professor B. Lynch, and we had again a hands-on workshop for everybody. And Dr. Suchitra helped me to prepare the module, particularly for the operative thing. So she shared the videos and slides and everything. And then we prepared a CD also, Dr. Suchitra, which we distributed in Chennai, in Chennai conference. And we also prepared a booklet on PPH. We distributed it in Chennai. So after that, it continues. And now also, again, we have prepared a module, some additions. I am doing it quarterly in Bangalore. And now people have come to know. So there is a demand in Karnataka and other places also. So in fact, this 9th also we have. And I have started involving people from government strata, like Bangalore Mahanagar Palika hospitals, as well as the family welfare department. Okay, so they depute every workshop. The government doctors are deputed and the nurses are also deputed. So they look forward for this. So this Sunday we are going to have even one doctor and one nurse from each hospital. And I think unless and until, like what Preeti is doing, that is the way forward. We have to train the people who are at grassroots level, because they are the one who are attending that. So that is how my journey is. And I thank all of them. And I know Dr. Sadhana that we are all into that trail, Safe Motherhood Committee trail, with, and now the Preeti has taken it really to heights, which is very nice. Another thing, the adolescent health, which Dr. Suchitra mentioned. I think I had an opportunity to attend the workshop where I got trained as a national facilitator on adolescent health. And Dr. Suchitra, it was nice to hear your experience. But I must tell you, I changed so much after attending that adolescent health workshop, that my attitude not only towards adolescents, but towards my patients, because that gather approach. And it really taught us a lot, that 4 days extensive training. And my team was also the same as a president. And I could do these programs in 100 schools in Bangalore. And then that we continue working with for Youth Mela. That was your idea. So I could conduct one Youth Mela with Family Planning Association. I was the vice president. And it was a very good experience. And I worked with family planning for adolescent health, because I was the vice president, and they have that IPPF project working on 5 A's: adolescent, abortion, AIDS, anemia, and advocacy. So through them also, I had an opportunity to again get in touch with the adolescents. We did so many school programs, transgenders also, and there is so much of learning when you come in contact with these special groups, And I must tell you that Dr. Padmini Prasad in Bangalore still continues to work with the transgenders, and we are trying to help them also. So there is so much of learning. I think if you have a will, definitely, the God will show us the way. And I think all of us, we must thank our local society and FOGSI for giving us the platform, because the platform is important, where you can really spread your wings. So that we got through FOGSI, and the encouragement, like Dr. Sanjay Gupta appreciated my PPH eclampsia charts when he was the president, and I showed it to him at that time, because my first workshop happened during his presidential year. And, we got a free hand. That is so important, they never said no. They said, go ahead and do it. And that they shown us the way that you do it, and everybody was there to appreciate our work. And I think that is how now we appreciate Preeti. And Preeti, your team, though so many people you have taken along, that is again a very good thing. In BSOG also, now we have started training people for our drills stations, and more people saying that, Madam, I would like to join, we would like to join. Preeti has come to Karnataka also. That is again another good news. Welcome, Preeti. So she is in Karnataka also. I think there is a lot to talk, but Dr. Sadhana, so the overall, I can say that all of us are here to care for the mother and child.
So
always.
that was something again, it is how do you start it and how that things go. And what we say that what always I say that any international organization or government will appreciate us only when we will work for our people, and especially the marginalized people. What Dr. Suchitra says, Dr. Sheila says, Dr. Preeti says, actually when we are proving that we are working for our people, then we get the respect from all over the like professional body, international, because always the whenever at not at national level but at international conference, when I listen that India contributes to 21% of maternal mortality, it really pricks, and that is this. So actually we took the trail from Dr. Sheila Mane, Dr. D.K. Datta also, like in a very small place that is Kalyani. He is having that lamp lighting, that she is doing a lot of nurses program and so many things. And how we change accordingly. Dr. Sheila Mane like focused on the training of the MBBS, like non-specialist, specialist doctor. Preeti take with that, Dr. Hema was in between, because Manyata actually opened our mind. My mind, actually, we say that where are paramedicals in our obstetrical care? And initially, we have to break our own barriers. And suddenly, within a very short span, we came to know that the training of paramedics is so very important for giving quality healthcare. Likewise, when we, as a chairperson in the first year, I did TOT at the India Habitat Center. As you came, so many people came for that. We have a pan-India, like a maternal mortality workshop in 11 and 12. But when I was vice president, Dr. Alka Kripalani says that will you do maternal mortality workshop? I say no, I will do saving mothers, because that is the country, what country is saying, that it is not only mortality, we have to give on the quality care and the multidisciplinary involvement. A lot of publication is still, so many people have all the safe motherhood bulletin in their things. So coming to the future challenge, what Dr. Sheila Mane says, that the emergency obstetrical care. Dr. Suchitra, you invited me to write on the EMOG, what is the review, and it actually says, because when we indulge into things, we came to know there is still a lot of geographical variation, rural urban divide, not only in the like places like northeast, or we can say in the remote area of UP, in the Gujarat, which is the one of the prosperous and having very low maternal mortality. There is a lot of regional divide between it, accessibility to EMOG, and the private sector who is having all comprehensive, but they are not doing assisted vaginal delivery sort of thing. So I want to have Dr. Suchitra that this divide, like the accessibility to EMOG, affordability, how can we take up this challenge further, so that we have to find the new solution to the what is gap left behind. So Dr. Suchitra, your takeaway.
Yeah, I think today one very good thing that has happened in the last, I think in 2014, I was the FOGSI president. And that year itself, we had started seeing the change. Most of the medical colleges are now having labs, the labs which are there, the skill labs. So because, and they were even the corporate hospitals were told that you must have it, because that's where the students can come to, actually do things. Again, there are lots of videos on the YouTube. They're all international videos. And when we told our people, I said, everything is international. Why can't we have some Indian videos? I'd asked so many medical colleges in my year, please do it. And I was very happy that 2 of them actually took up that challenge. And there's a very beautiful video which is there. I think it is from one of the Delhi medical colleges. They have it on eclampsia. What exactly happens? Patient aaya to kya karenge, kaise karenge, what should be first, what should be second, what should be third. So all that was actually there. It's now available on the YouTube. So if we have that kind of a thing, I understand we have the EMOC labs, we have the EMOC skill training, when Dr. Sadhana Desai was the FOGSI president, and ICOG and UNICEF, they said we'll carry it on for many, many years. It was going on. But everywhere where people got the, then you had the EMOC TOTs, where they were experts, and the experts went and taught the other experts. But now I think with Preeti's, model, where you can actually reach out to people with Zoom. And then once you have the Zoom, you've taught them the basic things. Then there are groups of that, the committee groups, where you have one expert going from that group and doing it actually on-site visit. I think that is the way forward. And I feel majority of the times the medical colleges, the head of the departments, the associate professors, and the medical officers of that particular area should also be trained. And this is not a one-time training. It has to be going on every 6 months. It's like, the continuing medical education thing. So then they can go on and train the other people. And I think one very good thing which has come out in the last 3 years, we've seen a steady drop in the maternal mortality, and particularly UP has shown a fall, significant fall in the trend. So I think we should take some credit, FOGSI and Preeti. They should take some, I mean, I would say a major part of the credit. There are other organizations working, but FOGSI is big. With FOGSI, when you have a chairperson like Preeti and she has an entire team dedicated, I think that's the way you can percolate to the, like she was mentioning about Beraich, you can reach out to the small little areas. I'll give you one more example. When we were doing the HDB certificate courses, Sadhana, we did 108 totally so far. We have gone to small places. I mean, we went to Srinagar. Srinagar, in the peak of summers, the temperature was 43. And me and Pratima Mittal were doing that HDB certificate course. And the full day, the audience was absolutely packed. More of women, very few men. But they were all there, they listened. And what we were able to drive home the point is, okay, what is an eclampsia drill? You must teach your residents. What is Maxwell? What are the main antihypertensives? So ye pura din itne baar bataya. So finally, the head of the department at the end of the day, she says, you know, I'm so thankful because we've got all our ideas cleared. So somewhere was passionate about going there. We do it. It's not a 5-star hotel that you go and stay. You stay in basic premises, but you go and do it at a place. So train them on the Zoom using Preeti's model, and then go and do an on-site training to see what exactly is happening. I'm sure Preeti would have trained her predecessors, and I hope the right person gets elected, because you have to have the right person. And here I'd like to say, all 4 of us, like I remember Sadhana was wanting adolescence, and I said, Sadhana, don't worry, apply again and you'll get Safe Motherhood. Preeti wanted medical disorders, but she got into Safe Motherhood. Sheila wanted to do adolescence. I said, Sheila, Safe Motherhood is good. I myself wanted Safe Motherhood, but at that time, we had a very nice person, Shirish Patwardhan, do it. And Dr. Gupta, Dr. Sari, I said, what is the point in doing an election? Take up a challenge, take up a new committee. Said, chalo, take up a new committee. So basically, what I feel is, if you want to work, you can work very well with the passion. And as you're working, you have your support coming along. Finance is always an issue, but you can still spread your wings, and gradually, when people actually believe that you are genuine, people start working. One last message I want to give: whoever is the FOGSI president, Sadhana's, in the election line tomorrow, Preeti may contest, Sheila may contest, whoever. There's a very beautiful conference, which I got it very late. I got it in the month of October, when 3/4 of my year was over. It is known as Public-Private Partnership. So it is known as Partners Forum Conference. I was invited and I went to South Africa, and literally, like you have a Swayambar, the girls on this side, the boys on this side, the parents in the center, and there is matchmaking, and fatafat unka, shadi jam jata hai. The same way, you have all the donors on one side, like you have Japaigo, you have somebody from the, all the big, the Mataji Foundation, the Raheja Foundation, the international big players are all there. And on this side, we are the ones who want the recipients. So like FOGSI, I was representing, there are many other NGOs there. And then they say, okay, what is your main interest? My interest is PPH, HDP, youth. Okay, fine. They will do a matchmaking, and they will tell you, okay, these are the 3 donors, Belinda, and Bill Gates Foundation. And immediately you go, you stand there with that particular group, and in less than 10 minutes, you just have to tell them what is my area of interest, and this is what the funding I want for. So that time we got a funding from the GSI, and that's how we were able to go in for the PPH. Just, Sheila is aware of that. She was also, I called her in for that. We had done a guideline through the government, which is there on the, on the government website. And we were able to work with the government officials on the strategic management of PPH, the tiered approach. So immediately the funding came. So all of you who are thinking of future, think about this Partners Forum, push so that you get invited earlier and you get the funding. There's huge funding available. Only thing, it has to be properly channelized, and being FOGSI representative, always the funds do come in. Only thing is they have to be channelized in the right.
Great, Dr. Suchitra, for your all inputs. And I think Preeti may went to the Women Deliver conference, and that was also having a little bit the same thing, that a lot of networking and the donors agencies and the recipient. And when we presented our work as Manyata, and actually our passion for Manyata did help JPAGO to get that continuation of the program. So it is always the two-way. One or two challenges, what we say before we sum up in the last 10 minutes. The midwifery course, I just went to Vardha like few months ago, and they are having the first batch of the midwifery, and around 17 people have enrolled for it. So now what's your comment, we would like to say from Sheila and Dr. Preeti, that if the midwifery cadre is evolved in next 5 to 10 years, how it is going to have impact on total obstetrical care, considering a very diverse scenario and the population's demand expectation in our country about the maternal child health. Any comment about this, Dr. Sheila, Preeti, Dr. Suchitra?
No.
Not
Yeah,
audible. So I can give comment on this. Dr. Sadhana, I also visited Sevagram and I saw that MLCU. I think it's a well-placed MLCU. And they have their all low-risk patients delivering there. A lot of respectful maternity care, guidelines are followed there. And what when I talked to Dr. Poonam Shikma, she said, initially there was a lot of resistance when we were starting this midwifery courses, because the residents were opposing that most of the normal deliveries will be taken care of by, and we will not get that opportunity to deliver the low risk cases. Then if you see the MLCU of midwives and the labor room of the doctors is totally interlinked. So there's just one door where you can just rope in the patient to the other side. But what I think, if it is a properly channelized, because we have just one center in UP, Meerut Medical College has been taken as, and JPAGO with the government is taking this initiative, and they are yet a lot of things, because I was there in one of their programs also here in Lucknow. It was International Midwifery Day. The hall was full, jam-packed, and they were very enthusiastic and eager to work in our country. But things, you have to weigh pros and cons. We have to look into the perspective that the complications might increase. But I think the medical colleges are the right place to start MLCUs, not as independent units right now. And Dr. Poonam Shivkumar said, definitely the cesarean sections have dropped since they have taken up. So this is what is the positive, because I'm worried about the increased cesarean section rates. So I think if they come into place in the medical colleges or in the district hospitals where the cesarean facilities are available, where the team is expert, then definitely MLCU will have a place, well placed in our system, and it will, provide a good health care and a quality care to the mothers and the newborn. This is my take on this, and I'm very pro midwife if it is channelized in a proper way.
Dr. Sheila, your comment. You have not audible. Actually, it will be the way ahead, the way our sub-specialization and super specialization is coming along. We have to be there, but always we have to be on the guard as well. So this is...
I think most of the Sadhana ji, we as an OBGYNs, we are not aware about the birthing positions. I think they as a midwives are very well aware about the, pain relief and the various birthing positions. If you see that, it's very, fascinating. If you see that labor room, I did this UPCOG conference here in Lucknow. We created that MLCU, and everybody visited there and they wrote their comments, and it was very exciting. But I think the time will tell, because most of now the government is pushing MLCUs in various states. So
and we have to be very particular about quality of the things, because otherwise, like something IUCD and lab sterilization,
place it in a medical college, I think that will work. Not in a district hospital right now, not in CHCs right now, not as a private setup, but in medical colleges. I think this is a way forward.
Dr. Sheila, you have to the same device. No, not audible. Not audible.
Sheila ji, phone se join it from
Dr. Suchitra, when you were vice president,
I just wanted to tell you something. I have worked in UK for 3 years, and for me, working with the midwives initially was like, my God, these are nurses, but they are as good as doctors. They can read CTG so well. They could give positions. They were so patient. And they were, like sometimes doctors are hassled because there are so many things you're doing, multitasking. A midwife, once she's dedicated to a particular lady, for the entire duty, she will be with the lady, be it a water birth, be it a normal delivery. And they do. An intelligent midwife is an asset. An intelligent midwife who doesn't keep egos in her head is an asset, because she will immediately call you, doctor, I think there's some problem. I think you need to intervene, or you need to do a fetal scalp sampling, or I think she's just past meconium, or something like that. But if I have seen the flip side of it is I've seen those very egoistic midwives also. Small, they think that they know everything, and they will not even call, they will not even allow you to enter the room. I had that experience, during a water birth. There was a patient who, she had a breech delivery, but she wanted to labor in water. And once she was fully dilated, she wanted to come out, stand, and push the baby out on her own. Fine, fair enough, do whatever. But I was scared, because if the baby's head gets stuck, she's a second gravida. If the baby's head gets stuck, what do I do? She says, no, please don't interfere. If there's a problem. So what we did was, I asked my consultant, what should I do? He said, just get everything signed. So we signed everything, got everything. Patient beautifully dropped the baby. The husband held the baby. They cut the cord. All that they did. But when you have a nice, sensible, practical midwife, fantastic asset. And I think the way forward is we must go ahead and encourage this. In my year, we tied up with Symbiosis. In fact, myself, Dr. Sanjay Gupta, Dr. Gorak, we attended 3 meetings. I think initial meeting, Hema was also there. The later 3 meetings, we were there. We said, please start off this cadre of midwives. They were already training. They're still training midwives. So we had 3 girls who were already trained midwives saying, ma'am, I am from Gujarat. There were 2 from Maharashtra. They said, we don't have the jobs. We're getting the same jobs, the same payment as a sister tutor gets. So we are reduced to teaching. We're not doing any practice. So which was very sad. This was 2014. Evita Fernandez has shown it that even in the semi-private sector, you can work well with the midwives. And Poonam has a wonderful program. I haven't attended that, but she's told me all about it. And I think, as Preeti very rightly said, medical colleges first, and then gradually, even in the private sector, Preeti, it may not be for a nursing home setup. But if you have a corporate sector where there are 100 doctors attached, 100 gynecologists, if we have midwives, and say I have a patient in labor and I have to go somewhere else, I can leave it to the midwife and the second set of consultants, like it is done in a medical college or in an NHS setup in UK. So the patient is safe, I am safe, the midwife is happy that there's a continuity of care, and patient is very relieved that I am not left alone. क्या हो जाता है, what she said very rightly, C-section rate क्यों बढ़ जाता है? Because then we also start getting hyper-obstetricians distress. Then we have change residents, we have change of nurses. अरे कौन सी resident रुक गई है, कौन सी nurse है? Then in corporate sectors, night times after 8 o'clock, the charges increase. So there are multiple variables, and then you start thinking, my God, the relatives are also pressing. Forget it, she's not yet delivered, let me do a section. That kind of a distress will go away if we have this, the midwife. I hope over a period of time, this comes in, and it will make a lot of difference.
Actually, you point that two things important.
Sadhana, just one last comment, not regarding this midwifery. What Dr. Suchitra mentioned about the partners forum, I think that's a brilliant idea. And what FOGSI needs to do is they have to produce the data. No organization will support unless you produce the data. That's the main thing.
That's very
so documentation and data, that is more, because as I entered Kasoga for FOGSI Vistrit, because I wanted to scale it up, challenges are there. The language is a challenge. It's a challenge. So then we try to find solutions for it. So we try to translate it into Kannada. So we have faculty from Kasoga who is translating everything in Kannada. We have put mentoring all through Kasoga only. So they are doing the mentoring in their own language. So you have to find things out, how the things will work. But then definitely FOGSI needs to move in a direction of documentation and producing the data to the government, to the various organizations, to the first, then only, otherwise no. So immediately when I took as hypertensive disorders, Dr. Sheila ji, I just wanted to make a last comment. One of the major funder, called me. And it's a US based funder, and they want to do hypertensive disorders. Dr. Suchitra, this is for your information. And I told them very clearly that Gestrosis India chapter is again another organization through which you can work. So probably once I get a data from Kasoga, I would present it to, and then probably we can get some funds for. It's a big organization. They are big funders. They have a lot of money. They want to work on hypertensive disorders. So I think that's the way. Once you produce the data, then only they will fund. So that's my take on this, because I've learned a lot of things through these projects, and your own work, you keep on learning.
I know.
Dr.
Preeti.
Sheila,
So regarding midwifery, as Suchitra said, and as Preeti said, yes, medical colleges first. But Suchitra, you rightly said for corporate hospitals and tertiary centers. I will tell you the situation is Bangalore. Nobody wants to work in a corporate hospital as a 6 hours, 8 hours duty doctor. They are consultant the day they pass. And now the consultants are struggling in corporate hospital because they don't have trained nurses to monitor. And that is the biggest problem. And I think midwifery will be the real help for everybody, because you get all patients from high strata. They are all, they demand everything, and if we have a proper midwifery training, it will be really good. Even I have visited Vardha, Sevagram, Dr. Poonam's place, and I know how it is. So I met those midwives from UK, and they said, see, you doctors are always in a hurry to deliver the patient, and which is very true, We just don't follow. And they said, we are not in a hurry. So they nicely, they plot the partograph, they wait for everything, which doesn't happen with a doctor. Even your resident also, because everybody is in a hurry. And all the more now when we are getting the residents, it is very important that they learn the right things in a right way. And that will only help to reduce the cesarean section. Because now what I observed in PPH is, PAS is going to be our real trouble. Placenta accreta syndrome. We will not be able to reduce the incidence of postpartum hemorrhage with increasing incidence of cesarean section unless and until we reduce primary cesarean section. We will have more and more complicated and more complex cases. And if we don't have the backup, if we don't have the proper blood banks, we don't have the blood storage units, again, we will have problems. So, Dr. Suchitra, Dr. Sadhana, you brought out a very important point. Midwifery is a way forward for so many things, not only monitoring, but to reduce the incidence of cesarean section. Yes, monitoring is very important. We have to know, and we should know when we have to come there and take over the case. That should happen. And I think it was a brilliant discussion from all of us.
We will have one point before you have. I mean, like when Dr. Suchitra was president, and I attended WHO 3 days meeting for essential postpartum and the newborn care. So because this is a discussion on maternal and newborn care, and here is the gap, because we are doing, we are doing at the FOGSI level many things at different training doctors. We are thinking for taking parallel midwife. So two things I wish to communicate to everyone when the 2012 WHO meeting on MDG. So that was on the task shifting. What we are calling for the midwifery, that train basic anesthesia, train basic all EMOC measure to the paramedical staff, and a lot of reservation. We saw a lot of reservation that it is not possible and it will be risky. But actually, some places it is very good, and the essential postpartum and the newborn care. Because if the adverse obstetrical outcome, we can do cesarean, we can have a delivery, but if the newborn outcome is not good obstetrical, then again the mother is in the cycle of again the birth and the complication. So what's your takeaway that how as a FOGSI, we have been collaborating, yes, funders are there, how we can collaborate in a much effective way with the people, with the neonatologist and the pediatric specialty, and how we can do the combined thing together. Dr. Suchitra, Dr. Sheila, and Dr. Preeti.
See, in my year as president, Sheila would remember, we had tied up with NNF, that is the National Neonatology Forum, as well as the IIP, because my friend happened to be the president of IIP at that time. So we decided we will be doing these neonatology workshops free of cost at all the possible conferences that we are having. So, in a year, a FOGSI president has a minimum of 6 to 8 conferences. Then we'll do it at the UA FOGSI forum. So we had a total of almost 20 neonatology workshops, and these were the skilled development at birth, the golden hour resuscitation. And we also tied up with our perinatology committee of FOGSI. At that time, Amit was the chairperson, Amit Patki. So he made a beautiful placard of the, which could be hung up at places, golden hour resuscitation. So all that was done. And they actually, IIP came up with those beautiful modules where you could start intubating and learning that. But this has to continue. The thing is, one particular year we do it, it should not stop there. I always feel, even if the next year's president comes, he or she may have a different theme, but this has to go on. So I believe some 3-4 years later, again, one particular time, sometimes, you have people who are interested in the endoscopy that is promoted. I understand everything new has to come in, but this particular basic skills has to continue. What we realized is,
Very true.
nurses who took up that simple resuscitation, a simple wiping the baby, giving a bag mask, and the baby cries. So they were so happy because they said, this is interesting, because humko ye pata hi nahi tha that we could do all these things. So I wish, Preeti, aapke Safe Motherhood jab tak aapke paas hai, again, start looking at the not NICU, at this, the skill birth attendants also learning something about the neonatal resuscitation. So you can do it.
Can I? Yeah.
Yeah, sure.
See, now there is a WHO project going on for this. Okay, because as Dr. Sadhana said, that you feel very bad when our maternal mortality is projected. So again, we are contributing maximum cases of epilepsy due to neonatal asphyxia, the birth asphyxia. Again, so there is a WHO project. So it starts during the internal time only. So there is new Doppler where you get the graphical representation also. So you not only get, the beat to beat variability, it is not between 120 to 160. And the we have respectful maternity care. So we allow the attender to be there with the mother, and which makes a lot of difference, that she is there to know that she is going through a lot of pain and she calls. Okay. So RMC, proper monitoring of FHS, so that you have that different Doppler where you get a graphical thing, and a neonatal resuscitation, the golden minute, which is so important. Now, one good thing with Lakshya is, Dr. Suchitra, it's not only that they are training the doctors, but the nurses and the Dakshata. The Dakshata is also there, and through Dakshata also they are training. What best thing is happening, at least where I work, I know in Karnataka and in Southeast, there is a accountability because we have audits, and these audits definitely help because, for every case, we call the postgraduate, we call the resident, we call the nurses, whose duty. So the auditing is helping a lot. The perinatal mortality and morbidity meeting helping a lot to improvise. But as you know, I must tell you again, the government has to look. It is not on par. The number of babies born and the number of beds available in NICU is not on par. And the poor people can't afford. When there is a need for a ventilator, the ventilators are not available because they are already occupied and they are overburdened. So the number of beds are not enough in our country. So unless and until the government takes that, it has to be like every hospital has to know that this is our workload and we need these many ventilators. The doctors are trained. I must tell you that after Lakshya, they are really dedicated, They really work hard, and because they are accountable, they are answerable to DHO, to the NHM, because it comes through NHM. So there is a lot of improvement. And as well, private people, yes, they always are worried and they will always have a pediatrician available, even though it is a vaginal delivery or it cesarean, so always anesthetist is always there. But I make it a point for a vaginal delivery, even in private, that the pediatrician is already comes and he waits for that case. So then only, we can avoid all these problems. Yes, we all are trained, but we are short of hands in private. You don't have so many hands. If you are delivering and you have other complication with the mother, you can't leave the mother and go and resuscitate the baby. So I think Manyata, you have those 16 clinical points, and I think Preeti, is the neonatal resuscitation is also included in that. And I think during Dr. Hema's time, we had saving mothers. So in that Mama Natale, we also had this
Baby.
baby also, and the demo of the neonatal resuscitation. So there is a long way to go, but I think we need to train each and everybody, definitely.
Dr.
So
Sadhana,
this is
there's
something
another
new.
project which is, I think FOGSI is doing in Jharkhand also. That's with GSI and USAID project. So that's there. But again, what this has to continue, what Dr. Suchitra mentioned, it would be there for maybe 10 or 15 facilities. And then again, the next president comes and again, those things move
And
like
beyond newborn resuscitation, actually, it is sepsis and the early recognition of jaundice. So it is something what we are doing a little bit at the ISO part, that it is always a dialogue. And I think in FOGSI, we have to make that culture that there is a persistent dialogue between the, especially neonatologist and maybe physician and the cardiologist for saving mothers. So it is something which is the need of our, because it is
I
not
think, Sadhana ji, it should not be like, it should not be like only newborn resuscitation, as you said, sepsis and shock, but also NCDs, because we have, you know, hypertensive disorders, GDM. I think there should be something like a course or a compact course where they can, you know, have an idea that this baby can land up in diabetes later on, maybe other diseases. So I think there should be something for prevention of NCDs also later on.
Dr. Preeti, we have our counseling, perinatal counseling.
So this is
when the
what
patient,
I'm
high
telling.
risk
So
patient,
this is what I'm telling.
high risk patient gets admitted.
Along with that,
we involve the pediatrician.
See, in the
So
government
before
hospitals,
delivery, there is a counseling.
so
So
in
they
the,
talk to the relatives.
no, my point is, Dr. Sheila, in the government hospital, you have everything there available. The consultant, counselor, everything is there. But what still I feel, the private sector needs more attention, and as a FOGSI, as an organization, should pay more attention to the private sector, because, you know, 40-50% of the deliveries are still being conducted. The manpower is less, you know, human resources are less. So knowledge building is very, very, you have to plug in the gaps, knowledge, attitude and practices.
Very true.
So certain things which are very important.
Thank you very
Sadhana,
much.
one concern,
Yes.
I want to
Yes.
voice one concern.
Yes.
All our gynec friends who have got children, all of the children are either the boys are doing endoscopy, the girls are doing IVF. And no harm. You can go ahead and, you know, sharpen your skill.
Now cosmetic gynecology is
No
coming up
problem,
like
no problem. But you cannot forget the mother. You cannot just say that because I'm an IVF consultant, I don't want to take night calls. No, these are the dialogues of the young IVF girls I've seen. I don't want to take night calls. I'm just going to do an elective section and that's it. Every IVF does not need a C-section. I understand complicated IVFs with complicated with multiple things, but simple, straightforward IVFs, why do we need to section all of them? बट नहीं, मैं तो सीजर करके आराम से जाके सो जाऊंगी, मुझे थोड़ी ना रात भर जगना है. These are the dialogues, and I'm telling you, sometimes it pains my heart. अरे you do your endoscopy, do it, but why do you forget basics में क्यों हम राड़े हैं हमारे? You know, we call it BMR, meaning why do you not want to do that? They just don't want to go ahead through that route at all. कुछ ना कुछ तो करना चाहिए इसके लिए. I
this is something which is a real concern of everyone, that first of all, to me, one can go into the endoscopy IVF when one has done around 8 to 10 years of the basic practice, because they don't have that comprehensive idea. And secondly, that is the classification that is actually creating a lot of issues at various levels, that we are declass, like we are having a thing, a very hierarchy, we are the big one or we are the glamorous, and it is all, and the average obstetrician gynecologist is like having, so that is actually creating a lot of hidden and the apparent thing at many levels, what we can say. So this is something that in my on all program, I always say that it is some of the most satisfying thing to do. And we have to be dependent on referral, and anyway, infertility endoscopy with a lot of medical management and everything available, it is only constant, always have the benefit 5 to max 10% of the population. But this is for physiological, for the always reason. So it will give us everything what the young generation have: money, satisfaction, recognition, name and fame. So this is something we have to look after. We will look very, very seriously about it, that how we can, like the young people are getting like totally defied and creating a lot of issues at many level, what we can say. So it is something we have to be first democratic within ourselves. So, and we have to be respectful within ourselves. That is the very, very important thing. So thank you very much for your precious time, Dr. Suchitra, Dr. Sheila, Dr. Preeti. It was really great to have all of your suggestion, because we have come a long way. Actually, we have traveled together, taking battles, taking inspiration, taking motivation, and it is something, a journey which is worth traveling, ongoing, and we have a lot of things to do, and a lot of aims for the people of our country and at the international level. Thank you very much. Thank you very much.
Thank you,
for
Sadhana.
the
Thank you.
discussion.
Sadhana.
Thank you.
Thank you
Thank
very
you,
much,
thank you,
Sadhana.
Dr. Sadhana.
Enjoy.
Yeah,